Edmonton City councilors and Public Health Committee members are getting their first look at a report on possibly decriminalizing drugs. It's an effort to reduce the number of drug poisoning deaths in the city, which claimed a record number of lives in Edmonton in 2021. Councillor Michael Jans is optimistic the committee will go forward with the motion.
I think there's wide appetite on council to see any options explored and everything on the table.
This comes after data was released revealing 2021 was the deadliest year on record for opioid poisoning deaths in Alberta, with over 1,700 deaths reported.
These are preventable deaths, and it's incredibly frustrating. And I think that we know what medical health and public health experts have told us, that whether we're looking at safe supply, decriminalization, harm reduction, all of these different pieces, they're critical to saving lives. In order for the Controlled Drugs and Substances Act exemption to be granted, it must be for one of three reasons: medical purposes, scientific purposes, or in the public interest. However, when the motion was first introduced back in January, those who enforce the law say they do not support the motion at this time, saying there aren't enough resources to treat addictions.
We're rarely arresting people right now for simple possession. So while decriminalization may sound appropriate and it may work from a small municipal side, it's not going to resolve or fix the issues here at all. And while I understand what they're trying to achieve, but without the proper programs, it's going to fail.
Despite lack of support from police, the City Council Committee will meet to discuss the possibility of moving forward with the motion on April 11th.
My goal will be to figuring out how we move forward, seeking solutions to a very complex problem.
In Edmonton, Laura Kraus, City News.